All right, now we're talking about hot flashes, cold chills, fatigue. These can all be symptoms of hormone imbalance. Dr. Clark Hansen from the Hansen Clinic of Natural Medicine is here to talk about bioidentical hormones and how they can help. Good morning, Dr. Hansen.
You're welcome. Glad to be here.
What are they exactly when we say bioidentical hormones?
Well, that simply means that just exactly like the body makes. All of our drugs, in order to be patented, have to be copies of something that's in nature. They can't be exactly like nature in order to get that patent.
Gotcha.
And when you change something like that, then you create more toxicity. So we know that the synthetic hormone replacement therapy actually doubles a woman's risk of a heart attack, not to mention other conditions, even cancer. So they copied the wrong actual hormone from the body. They copied estradiol. We recommend estriol, which is the safe estrogen. It's 1,000 times less stimulating to breast tissue and uterus tissue, which is mainly for women to prepare for pregnancy, but you don't want that stimulation after menopause. So a woman who's going through all these symptoms, we kind of think this is just a nuisance. It's trivial, we should just get over it, but really it's a sign that there's an increased risk of cancer if you don't get these hormones in balance.
Which ones are the most important ones to look at?
So we want to look at estriol, all the estrogens. So we want to make sure you don't have too much estradiol or estrone. You have plenty of estriol, that protective one, and you've got progesterone, which is also protective. It stimulates the bone growth. So that's the best osteoporosis remedy is progesterone. It also prevents cancer by stimulating a protein that activates against cancer. And then testosterone, which many women don't even know they have, but you need it for sex drive, but you also need it for muscle integrity. Women start to lose muscle, and as they age and testosterone goes down, they actually start to accumulate more fat. Women tell me, I've all of a sudden gained 15 pounds.
Right.
And the last few months, it's because they're losing muscle, which is the furnace that burns fat.
How do we know if we need them? Like, how do you know, okay, I think my hormones are out of whack? What are the symptoms?
We test.
Okay.
But I'm going to tell you a story about a patient of mine who came to my office last time we did the show in May. She saw the show. She came in to see me. This is real typical. So she had the moodiness. She's 54. She's been having hot flashes for 4 years. She's got symptoms of hot flashes that are disturbing her sleep. 2 to 3 times a night she's waking up soaked from head to toe. And 5 to 6 times during the day, she's just moody. Of course, you're going to be moody if you're not sleeping. Mm-hmm. And she's got this weight gain we talked about. All of a sudden, where is this coming from? Memory loss also. That relates to a hormone called pregnenolone. That's the precursor to progesterone and DHEA.
And I think a lot of women think, well, this is just part of getting older. I've got to accept it. So how do we test to know if they're kind of out of balance?
So we do a hormone test. We measure all of those. We can use saliva test or we can use blood test. And we actually find out exactly what the levels are, and then we can prescribe. So my patient, we'll call her Fran, she came in the first time, and we gave her initially our multivitamin and grapeseed extract. That's my foundation for everybody. Grapeseed affects the collagen, the elastin in the body. She was having varicose veins and joint pain. Those are symptoms of collagen.
Wow.
And we gave her estriol, the natural estrogen. Within 2 weeks, she came back. She was sleeping perfectly through the night, not waking up again anymore within 2 weeks.
And they're natural
hormones.
hormones.
And it's natural. It's a sublingual. It goes under the tongue. The pellets they inject under the skin, they last 4 months. And if you get it wrong, you're going to have adverse symptoms for 4 months.
Sure.
And the injection is testosterone plus estradiol, which is the wrong one.
Well,
so we test, and then after 2 weeks, she comes back, and we find out exactly what the levels are. Then we needed to add progesterone and testosterone. She was really low. Her testosterone was off the chart low.
So you kind of custom fit it for each
Exactly.
person, what you need to do. There's a special offer. I know a lot of folks are interested because they want to get on.
Yeah, we want everybody to go to our website to learn more. We'll have some stories posted like this, what to do if you're out of balance, what the tests are. We're going to give away a free test to one of our people that sign up for our newsletter. Okay. We'll have a drawing. And everybody else will get a $50 gift certificate towards the first visit. Come in, you need to talk to us and get the answers.
Very important. Thank you, Dr. Hansen. And if you want the information, if you want more information on bioidentical hormones, what we talked about, please go to drhansen.com or call the number you see right there on your screen.